Tonsillitis: what it is, causes, symptoms, signs and treatment. Tonsils are lymphatic nodes, usually two, which can be seen appearing on either side of one's throat. The main purpose of tonsils is to defend your body system, thereby helping it withstand infections. Tonsillitis is therefore a condition that results from infection of the tonsils. Although tonsillitis is synonymous with children infections, it can affect any age group. Mainly it affects preschool children as well as school-going kids and those who are just attaining teenagehood. Major symptoms of tonsillitis could include fever, swollen tonsils, and sore throat. Tonsillitis is a contagious infection which is mainly caused through infection by known bacteria and viruses. For example, the bacteria responsible for causing strep throat called streptococcal bacteria. Tonsillitis caused by this kind of bacteria, streptococcal, can be very dangerous if not treated. Diagnosis of tonsillitis is very simple and normally the visible symptoms disappear on their own in about 7 to 10 days. What causes tonsillitis? Tonsils remain to be your body's immediate defense mechanism when diseases strike. Tonsils act by producing WBCs, white blood cells, to enable your body system fight invading pathogens, protecting you from getting tonsillitis. All viruses and bacteria that invade your body via mouth opening are handled by tonsils. It is also good to remember that tonsils are never indispensable and are likely to be affected by the invading tonsillitis causing bacteria and viruses. Tonsillitis usually caused by infection from bacteria, for example strep throat, or viral infection like flu. AAFP, American Academy of Family Physicians, says that between 15% and 30% of tonsillitis patients are as a result of bacterial infection, and in many cases the streptococcal bacteria is involved. Commonly tonsillitis is caused by viruses, for example Epstein-Barr virus causes both mononucleosis and tonsillitis. At schools, children become more vulnerable to tonsillitis causing germs since they get into contact with their colleagues, thereby exposing themselves to a number of bacteria and viruses. Symptoms and signs of tonsillitis: there are many categories of tonsillitis, and likewise there exist several possible signs and symptoms such as difficult throat sores, pain when swallowing or getting hard times while swallowing, hoarse voice while talking, smelly breath, high body temperature, feeling cold, earaches, aching stomach, painful headaches, neck muscle springs resulting in stiff neck. As a result of inflamed lymph nodes you experience neck and jaw tenderness. Inflamed red tonsils seen at the back of the throat. Yellowish or whitish tonsils can be seen. For the case of children with tonsillitis, you are likely to see them get irritated easily, poor eating habits, or too much drooling. The two categories of tonsillitis are A. Intermittent tonsillitis, where a patient suffers a number of severe episodes of tonsillitis in a year. B. Critical tonsillitis, where a patient suffers episodes of tonsillitis that takes long to heal as compared to intermittent tonsillitis, as well as display of additional symptoms such as chronic throat sores, halitosis or smelly breath. Neck lymph nodes are soft. When is the appropriate time to visit a doctor? It is unusual to experience heavy swelling of the throat as a result of tonsillitis to even make it hard for one to breathe, but in case it does happen, visit a doctor to get medically checked. Also, you will need to visit a doctor in case you get symptoms similar to the following: body temperatures exceeding 39.50 centigrade, 1030 Fahrenheit, weak muscles, stiffness of the neck, throat sores that persists beyond 2 days. Take note that in many occasions bouts of tonsillitis do disappear after a number of days without medical attention, but tonsillitis bouts may prove very challenging to require medical treatment. How to diagnose tonsillitis? Diagnosis of tonsillitis is usually done through examining one's throat physically to see the lymphatic swellings. Sometimes the doctor could ask for culture of the throat be collected by laboratory technologist and examined to find out the main cause of infection in your throat. Treating tonsillitis. Slight tonsillitis do not really need medical treatment, especially if the tonsils are caused by flu virus. Severe tonsillitis cases or even critical tonsillitis cases could require seeking medical prescription, which may involve using tonsillectomy or antibiotics. Prescriptions for antibiotics in treatment of tonsillitis will be for managing infections from bacteria. Antibiotics dosage should be followed strictly to the end. Do not mind if your physician wants you to make a return visit to the clinic, hospital just to confirm the effectiveness of the medication administered. In more serious cases, tonsillectomy can be performed in order to eliminate tonsils. It was a highly common procedure sometimes back, but in today's world tonsillectomy is only permitted for patients who suffer critical or intermittent tonsillitis. Similarly, for treatment of unresponsive tonsillitis or complicated tonsillitis, tonsillectomy is usually endorsed. For a patient who is dehydrated as a result of having tonsillitis, fluids may be given through intravenous. Painkiller medications can also be prescribed to manage the healing throat. Home remedies for managing throat sores and tonsillitis. Drink fluids in plenty. Maximum rest is necessary. For a number of time each day, do salty warm water gargles. Keep lozenges in the mouth. Ensure that the air around your home is moistened. If needed, apply humidifiers. Keep off smoke. Sometimes you may choose OTC, over-the-counter, medicines to manage pain like ibuprofen or acetaminophen. Please seek medical advice before administering medicines to young ones. Complications arising from tonsillitis. Patients with critical tonsillitis may at times suffer shortness of breath as a result of blocked air passage, simply known as obstructive sleep apnea. This usually takes place when the air passage is swollen and hinders a patient to enjoy their sleep. It is certain that if not treated, the infection could possibly move to different parts of the body, commonly referred to as tonsillar cellulitis. This infection can make an individual to start having pus building up at the back of the tonsils, basically referred to as peritonsillar abscess. This may result in surgery to drain the pus. Failure by the patient to complete the right dose of antibiotics prescribed, or if the bacteria develop resistance to antibiotics, the individual may have complications such as post-streptococcal glomerulonephritis and rheumatic fever. Prevention of tonsillitis. It is good to remember that tonsillitis is a contagious infection. In order to reduce chances of getting tonsillitis, keep off persons who are already infected. Clean your hands always, more specifically every time after you've interacted with an individual with throat sores, sneezing or coughing. It is a sign of concern to keep off other people if you know you have tonsillitis until you are well. Viewpoint of tonsillitis. People having tonsillitis may find it hard breathing, which may lead to troubled sleep. Untreated tonsillitis could be a cause for other opportunistic infections, especially around the tissues lining the throat and at the back of tonsils. Bacterial-caused tonsillitis is likely to disappear after a short while of antibiotic dosage. To be free from exposing others to infection, you must be under medication, antibiotics, for at least 24 hours.